When I ask breast cancer patients what the biggest struggle that they had when they were diagnosed with breast cancer is they were given the diagnosis and they did not know what to do next. Believe me, I was in the same boat. As an emergency physician, I had a wealth of knowledge at my disposal around chest pain, abdominal pain, strokes, trauma, all immediate life threatening emergencies. But cancer, I really knew nothing about chemo, about mastectomies, about breast reconstruction, and other breast cancer related subjects. So I went to medical school for 4 years and to residency for another 4 years in emergency medicine. But there's no way I could find the cancer information I needed with a quick Google search. So then, if you're asking yourself, what should I do now after my diagnosis? Put that time you have into researching the hospitals in your areas and research the physicians in your areas. At least after your diagnosis, you'll need one oncology appointment and one surgery appointment. But I really recommend getting second opinions. So research two oncologists, two breast surgeons, and schedule those appointments. You could ask to be on the wait list if there aren't readily available appointments. So I was 42 at the time of my diagnosis. If you're like me, I'd recommend literally Googling young woman breast cancer oncologist, Denver, Colorado. If you're wanting to have kids and haven't yet created the family that you want, you can Google young woman breast cancer oncologist fertility in then your city. And the results that popped up for me when I Googled young woman breast cancer oncologist Denver, Colorado, it popped up with my actual oncologist who I was referred to by a friend of a friend. And then another oncologist that specializes in young women with breast cancer. I'm sure most oncologists are great, but some of them see broad spectrum cancers and they don't specialize just in breast cancer. I want somebody that sees this day in and day out and really, knows the best treatment for me. So when you're trying to choose your physicians, what I would do after you come up with a couple of physicians, I would Google them and look at their reviews. Make sure that the patients like them, make sure that the patients are confident with their care, and make sure that the physician is available for them when they have questions. So I disregard any negative reviews around billing. That's really between you and your insurance. If an oncologist that you're wanting to see doesn't take your insurance, then don't use that oncologist. It's your job to make sure that a doctor and a hospital is in your health insurance network. The other thing I would disregard is any negative comments related to getting an initial appointment. If the physician's a good physician, it's going to be a little bit harder to get in with them. But like I said before, I'd still try to get an appointment with that physician, and I'd ask to be on their wait list. So hopefully you can get an appointment in the near future. Stay tuned. I'm going to post more videos on what to do next after your initial diagnosis. If you found this helpful, please like and follow us at Outside the Doc Box and jump over to our website at www.outsidethedocbox.com and sign up for our mailing list. Shoot us any questions that you have and we'll try to address those in our videos and on our email list. Once again, I am a physician, but I'm not your physician. For any questions related to your own personal healthcare, please reach out to your healthcare team.